Hey guys, welcome back to the channel. So last class we have started with the chronic sclerosing osteomyelitis. We have seen the clinical presentation, pathogenesis, differential diagnosis and radiographic finding. Today we'll be continuing that. Coming to the diagnostic workup, mandible require medullary bone exploration for biopsy and cultures. Clinical examination and radiographic are discussed and correlated. So clinical examination and radiographics are sufficient, but sometimes biopsy, medullary bone exploration, biopsy and culture are required. Coming to histopathology, chronic inflammatory process with reactive and reparative features. So it is mainly a chronic inflammatory process which shows both reaction and repair. Marrow will appear fibrous, inflammatory cells like lymphocytes and plasma cells, neutrophils, irregular thick osseous trabeculae with increased resting line. तो there are resting line दिखते हैं prominent. The sclerotic component is dense bone with prominent resting line. तो जो हम sclerosis की बात कर रहे हैं, the sclerotic component is the dense bone with prominent resting line. सो हिस्टोपैथोलॉजी क्या क्या दिखेगा हम लोग को? पहले तो फाइब्रस होगा. इट इज़ द सबसे मेन चीज़, इट इज़ द क्रॉनिक इन्फ्लामेटरी प्रोसेस. फाइब्रस हुआ और इन्फ्लामेटरी सेल्स प्लस न्यूट्रोफिल्स दिखेंगे. इन्फ्लामेटरी सेल्स में भी लिम्फोसाइट्स एंड प्लाज्मा सेल्स, एंड देयर इज़ अ डेंस बोन विथ प्रोमिनेंट रेस्टिंग लाइन. नाउ कमिंग टू ट्रीटमेंट प्लान, antibiotic alone or in combination with hyperbaric oxygen and decortication can reduce symptoms. Okay, this is not the treatment of choice, or this is not the treatment which will be fully successful. This can reduce the symptoms. What? Antibiotics alone or in combination with hyperbaric oxygen and decortication. Now, what is the drug of choice? Drug of choice is penicillin. And patient allergic to penicillin, doxycycline is the drug of choice. Okay, penicillin भी effective सबसे ज़्यादा कब है? The most effective treatment is high dose aqueous penicillin. सबसे effective treatment क्या है? High dose of aqueous penicillin at 3 million unit every 4 hours for 1 month. तो एक मंथ के लिए हम लोग 3 मिलियन यूनिट देंगे एक्वस पेनिसिलिन का फॉर एवरी 4 आवर्स, एंड विच इज़ फॉलोड बाय 1 मिलियन यूनिट एवरी 4 आवर्स फॉर नेक्स्ट 5 मंथ्स. तो पहले 1 मंथ के लिए 3 मिलियन यूनिट फॉर 4 आवर्स, एंड फिर नेक्स्ट 5 मंथ के लिए 1 मिलियन यूनिट फॉर एवरी 4 आवर्स एक्वस पेनिसिलिन, एंड दिस इज़ द मोस्ट इफेक्टिव ट्रीटमेंट. ओके. Now, in severe cases, resection of the affected bone has eradicated the disease. So, जब ये severe है osteomyelitis, तो resection is the choice of treatment. Continuity defect is reconstructed by titanium plate immediately. अगर immediate reconstruction करना है तो we give titanium plate, but it is said that definitive bony reconstruction is best deferred approximately 6 months to complete the antibiotic treatment. Okay. Now, coming to the prognosis, physical debridement would be the treatment of choice and provide an improved prognosis. जो physical debridement है, we have seen that would be a treatment of choice, लेकिन antibiotic along चलना चाहिए. The choice of antibiotic is penicillin. Now, it provides an improved prognosis, but the extent of mandibular involvement often requires a resection. We have seen, अगर severe है तो resection is the treatment of choice with antibiotics. Once the osteomyelitis is resolved and an infection-free, contamination-free tissue is developed, standard bone grafting techniques can be employed to reconstruct the defect. और जब हम देख रहे हैं कि osteomyelitis रिजॉल्व हो चुका है एंड देयर इज़ अ इन्फेक्शन फ्री एंड कंटामिनेशन फ्री टिश्यू आ गया है, बन गया है, सो जो हम रिकन्स्ट्रक्शन करते हैं वो बोन ग्राफ्टिंग से कर सकते हैं. इमीडिएट तो हम टाइटेनियम प्लेट से करते ही हैं, बट बोन ग्राफ्टिंग इज़ ऑल्सो अ चॉइस आफ्टर द infection free and contamination free tissue is developed. That's all for today. We'll be starting the next type of osteomyelitis in our next class. Till then, like, share, subscribe and comment. Bye.